The Coalition Government have put forward their proposals in the recent Health and Social Care Bill to establish an economic regulator which will, among its powers, have the function to promote competition. And unlike the current arrangements, it will actually have powers that are concurrent with the Office for Fair Trading. So it's a much stronger powers to intervene in healthcare to create a market. There's mixed evidence about the impact of competition on the quality of hospital care in particular. Evidence from the United States, where they have price competition, suggests that it has a negative impact on quality. Some recent studies here, quantitative studies, suggest that where we've had competition but with fixed prices, we've seen some small quality improvements. However, our qualitative interviews with providers as part of the evaluation of choice found that it wasn't the main driver for providers whether they were competing for patients. It was things like waiting time targets, the mission and vision of the organisation to improve care. I think there's growing recognition that competition is a means to an end, not an end in itself. We need to use competition where it's going to promote efficient services, better patient care. There was recognition at the debate that primary care and general practice was an area that was ripe for more competition, but that specialist tertiary services, competition probably wasn't appropriate, and we needed a bit more planning in those areas. Within the government's proposals, they're talking about having an any willing provider, which would mean that patients would have a free choice of any provider. The idea being that providers will compete for patients. From our research about choice, patients are very loyal to their local hospital, and so we don't think that choice will be a key driver for quality competition between hospitals in future.